Actually, this Ramadan period, and from our own perspectives, that this is the time for us to really make more impact by sensitizing our community, because this is the period that you can easily get to reach out to many people because of the utilization of the tafsir. And we are going to look at how we as women, we can reach out to more women in the communities, in the local governments, to really sensitize them about the vaccine. We are also going to partner with the primary health care so that the vaccine will reach out to where the women or the general public needed it, not only at the facility, but we can also utilize how we can reach out to the people, not to just sit at the facility and wait for the people to come to the vaccine. That is basically, most of the people are not going to the facility to get the vaccine. They wanted the vaccine to be at their doorstep, whereby in that particular community they will also access it. And we are also looking at the Hajj is coming, and most of our people, if they don't have that vaccine, automatically they are not going to have that opportunity. So it is really something that we as Form 1 and other organizations, we need to do more, so that those at the rural areas, those at the hard-to-reach areas, understand that they will not be able to perform these religious rites without having this vaccine. And as you know, 2 years back, we are unable to go for Hajj, and many of these rural people have gathered their money and now trying to go. So with only not accepting this vaccination, they won't be able to have that opportunity. So it is also time for us to get more people, more information to reach them, and more access to the vaccine at the doorstep of the people.
I must say that the challenges are enormous, but that notwithstanding, we are working towards addressing them. The major issue is vaccine administration, control, and accountability, where we may need to have, as a country, as recommended by international partners, WHO and other critical stakeholders. Nigeria has a vaccine policy that is all-encompassing for vaccination across the country. But however, we are recommending that stakeholders, researchers, administrators, and policymakers should come up with COVID-19 vaccine policy administration guide that will serve in identifying marginalized groups, targeted groups. There will be a working document that will promote more uptake, especially across geographically hard-to-reach areas, targeted populations, the vulnerable population, and other parts of the society. This policy document will fully, if adopted, or if at all Nigerians stakeholders will come up with it, will fast-track and be a critical policy document that will guide and address all possible challenges that are raised. Now, second issue is vaccine accountability, cold chain management system, and vaccine delivery. Now, we all know that we have dwindling light supply across the country, and we have sometimes poor transport network system, and some states we do face banditry and insurgency. Now, target populations that are to be vaccinated might have these challenges as a disadvantage. So we are advocating that critical stakeholders, Federal Ministry of Health, the National Primary Healthcare Development Agency, development partners like CITAD, MacArthur Foundation should come up with an idea on how to sort these problems out. Now, other issues is vaccination spots. Now, the WHO has recommended that we should have adopt a multi-strategic vaccination spots or policies. Now, this may include temporary mobile clinics where targeted populations in marketplaces, places of worships, like during tafsir or in churches and mosques, will be largely identified, and vaccination will be given out in these mobile or temporary sites. Other issues are intensified immunization campaigns and perhaps fixed healthcare facility vaccine administration centers, which is currently what Nigeria is undertaking. Now, other issues is increased budgetary allocation to COVID-19 vaccine uptake across the state, across all federal agencies, and increased budgetary allocation may even include those stakeholder budgeting processes. Other issues is risk communication strategies, where we can be able to have identified risks, we communicate them, and we proffer solutions on how to sort them out.